Hello everyone, and welcome to this audio podcast. This audio podcast is part of the LabZtorm Diggamount. This audio podcast is part of Component Storm and Lobostics. This audio podcast is part of the Shipmo Squad, and this audio podcast as part of a Storm Lobostics production. So I look at some aspects, some bases in around RBT practices, red blood cell transfusion practices, red blood cell transfusion fusion practices. So transfusion practices have been advanced in incorporating many novel or varying novel pharmacotherapeutic agents, um, at least in some ways to sort of to sort of compensate the use or in some regard um, of for example donated red blood cells and into the in sorry in view of the potential side effects that RBTs or red blood cell transfusions can elicit, and there is ever more need or a requirement to consider at the same time the synthesis of the endocrine EPO, um, the endocrine erythropoietin or EPO, and wherein SCA or thalassemia carriers can have or could have a synthesis defect. So although risks are reported in the use of EPO as pharmacological interventions linked to varying pathophysiological conditions, this has also led to sort of a reevaluation of the criterion for the use of blood. However, transfusion practices have not been have not been modified as approach to due to as a modified approach due to the anxiety or the fear of the mortality and morbidity relating to primarily anemia. So in a context of irrespective or it's just irrespective where patients or recipients, for example, irrespective of patients whether they're, for example, sickle cell anemic or thalassemic, for example, and or for example where they have, for example, if they have low HB or low hemoglobin, for example, the primary aspect is and has in line to blood transfusion practices in context of laboratory medicine. It is to is to it has always been to ensure that hemoglobin that the hemoglobin is at a correct level. Thus primarily treating the anemia or anemic aspect, and especially in untransfusible recipients and patients or recipients at risk of developing complications or further complications. And so at um, the same time, the physical characteristics of red blood cells, RBCs, properties allow the solubility of plasma oxygen by an estimated 30-fold. In addition, the affinity of red blood cells for oxygen is modulated by regional acid-base conditions to favor oxygen loading at the pulmonary alveolar capillary interfaces, as well as unloading at the tissue level. So at the same time, unfortunately, there are no clinically available fluids again that have the sort of the same basis of red cells of red cells or RBCs. Draws this audio podcast to a close. And this audio podcast is part of the LabZtorm and Diggamount. This audio podcast as part of a Capola and Storm and Lobostics, and this audio podcast as part of the Shipmo Squad, and this audio podcast as part of a Storm Lobostics production.